Good morning, all. So, today I'm here to discuss about the introduction of OET speaking for nurses. So, I hope all are safe and all are fine and on the way to achieve your dreams. So, I hope this video will really helpful for your OET speaking session. As you know, the OET was only applicable to Australia, New Zealand, UK, Ireland, and Singapore. And now there's a happy news the OET is applicable to the USA also. So, the healthcare professionals, the nurses, doctors who really want to migrate to the USA, you can use this golden opportunity. So work hard, get your desired bands, and fly to your wherever your destinations or your dream countries. It's time for that because definitely you will get more time and now because of the lockdown or the COVID pandemic situations. So anyway, I'll talk about the OET. As you know, the OET contains the four modules: writing, speaking, listening, and reading. And the listening and reading are same for all healthcare professionals, but the writing and speaking are different, depends upon the healthcare professionals. For example, the nurses have different writing and speaking, and the doctors and the physiotherapists should have their different writing and speaking sessions, like different that modules will be different because that's purely focused on your clinical practices or what they have taught on your clinical settings or your study periods. And I would like to share some informations about the OET speaking. I'll give you a brief introduction. What will be in the OET speaking session and the examiner or the interlocutor? What are the questions they will ask you? The OET speaking is for 20 minutes and that contains two role plays and some of the warm-up questions and your self-introduction. So let's start with self-introduction and the interlocutor may ask some three or four warm-up questions. So I will discuss the warm-up questions later. And later on you need to start your role plays. Why it's named as role plays, not a speaking session? So you would definitely think about that. So don't worry, no need to act as a nurse as like you have done on your study periods. You have conducted many role plays, so it's nothing like that. You should speak as a nurse with all sympathy and empathy towards your patients. It's what they are doing is they are creating a clinical settings during your speaking session, and they will assess whether you have that all nursing quality, whether you can deal with all kinds of patients. Maybe you will get a reluctant patient or you will get a good patient, or what are all the patients, whether you can able to manage or how you are managing, and your sympathy or your empathy and your listening towards the patient conditions, all the things they will check. So because of that you have two assessment criteria. So one is linguistic criteria and other one is a communication criteria. So who are all the candidates? They are very good in English and they will speak English without any errors or without any grammatical issues, but your sound tone is not appropriate for the nurse, or in your sound quality there is no empathy towards the patient. I'm damn sure you will not get your B pant. That's why they included both linguistic and communication criteria on your assessment test. So, hope you understood the concept, like what is OET speaking session. And as I told you, the OET speaking is start with a self introduction. So, what is a self introduction? What are the things you will include in your self introduction? It's nothing but you should definitely say your name. So myself so and so, and where you from, and then you should tell about your professional background. Like I have completed my BSc nursing or what all the nursing in the year of what is the year and from which college or which university, and how many years of work experience do you have. That's more than enough on your self introduction. No need to tell about my family consists of 5 members, my father, mother, and so, and my hobbies are all these stuffs. No need to tell about that. So please keep it in mind. The self introduction, you should say only your name and where you from and your where you studied, and if you have any experience you should include that. Okay, and if I tell about the warm-up questions, so the warm-up questions will be, why did you choose nursing as your profession? So definitely you must have the answer. And tell me about your professional background. So what is your professional background? So as I told you, your work experience. So I have been worked as a nurse for 3 years. And which department? And you should include and what all the things you have learned from that department. So that is the professional background, and which all the hospitals, some of them have couple of years of experience like 10 years, 12 years, and they have got a good exposures from different countries, so you should definitely include that. Okay, and please present everything with confidence. That's more than enough, because some of the candidates, they speak very fluently, they know everything, but when they during the examination time they can't speak out or they can't express. They have that idea in their mind or in their brain, but they can't express. So should not, please should not do that, because confidence is everything. With confidence only you can speak or you can express what you really need to express. Okay, and the other these warm-up questions will be, tell me about your positive and negatives about your profession, and why did you choose OET, and where do you want to migrate and why, what are your future dreams or your future plans as a nurse, and how successful nurse you are. So these are all the warm-up questions they usually ask, so you should definitely prepare about all these warm-up questions. Keep on practice. Okay, the OET speaking sessions, you can't speak in a one day, or you will not get that desired goal or desired band in one day or 10 days. You should keep on keep on practicing. As I told you, this OET speaking is quite different because they will assess many things. The next video I will include all the criterias in detail. So what are the things they will assess in all the criterias, all the assessment. So I'll definitely discuss with you guys. So what you really want to do is, what all the things you are speaking or what all the things you are doing, so please speak with confidence. And definitely it's a English assessment test, so they will assess your grammatical issues, grammatical errors, and the way of presentation, everything they are going to assess. And then the what will be the question? So I will briefly tell you. Okay, so as I told you, it's a purely based on your clinical settings, and you should act as a nurse and the examiner will be act as a patient. So for example, the questions will be like this: you are a ward nurse and you are you got a patient with a bronchitis. Yeah, you can consider bronchitis now. The patient is having breathing difficulty, and the patient is very much anxious about his condition because his condition is getting worse day by day and he don't know what to do and he is getting tensed. So your role play questions will be: please convince the patient, okay, because he is getting well soon, and provide information about bronchitis and its management. It's just a sample I'm telling you. So how you can present it? So because you will get 3 minutes of preparation time for your before your speaking session start. So you can utilize that time properly, and you should tell, you should act as a nurse. So when you start the conversation or when you start the speaking session, you should definitely act as a nurse and you should see the picture in your mind or visualize the picture, then you will not forget. And the speaking session must have introduction. What will be the introduction? So introduction, so I'm one of the registered nurses, so definitely registered nurse. I'm one of the registered nurses in this particular department, and today I'm going to take care of you. How can I help you? So this must be your introduction, and then later introduction and body must be the what is the body? As I gave you 2 or more questions, so convince the patient because he is very, what to say, very panic about the situation, about his condition, and he's nervous and he's anxious. So convince the patient he is getting soon and we are giving all the medications, and tell him about the condition, what is bronchitis and what are the management you are doing. Okay, so that is your body. And conclusion, what will be the conclusion? So you should conclude what all the things you said to your patient. You should briefly explain, or you should conclude it in a precise form, and you should tell that to the patient. So this is your speaking session. So next class I will explain I will explain in detail about the criterias. So then we can move on to daily. We can discuss 1 or 2 role play questions. So you will get a idea about the OET speaking. So thank you guys. So stay blessed. Take care.